get started back again, we have a great panel discussion coming up that I mentioned around challenges in implementing security regulations in the EU. We have a moderator, Carlos Arglebe, who's the Corporate Cybersecurity Officer for Siemens Healthineers. And then we have, like to introduce our three panelists. The first one is Errol Weiss, who is the Chief Security Officer for H-ISAC. The second panelist is Shriekanth Iyer, who is the Business Development Director of Healthcare for Irdeto. And then our third panelist is Katja Stadelmann, who is the Group Data Privacy Officer and Head of Data Privacy Compliance for Siemens Healthineers. So Carlos, I'll turn it over to you, sir.
Thanks, John. And by the way, I just noticed that there were some questions coming in from the previous presentation, John. I think we want to follow up on that tomorrow with Dina, so we don't forget those that valuable input that people have shared.
Yes, sir.
Yeah,
will do. Thank you.
So thank you everyone for joining in for this panel discussion remotely and on site. This is really a good opportunity for us to reflect together. So if anyone has a question, we'll definitely be able to address it because we heard some great things already this morning. We're going to talk about challenges in implementing regulations. And this morning we heard already about some great challenges on privacy regulations. And I would like to jump right at Katja to ask you the question, when you heard all that on the new regulations coming up, the existing regulations, we've got HIPAA, GDPR, we've got the Schrems II court ruling, we've got a variety of cybersecurity laws and regulations coming out around the globe. Do you see challenges in implementing those rules?
Definitely.
Which ones are they, Katja?
So there are a lot of challenges. So first of all, you remember when the GDPR was introduced in 2018, everyone hoped that this would basically streamline the data privacy approach in the EU. But when you look at the regulation, there are so-called opening clauses in it which enable the local country legislator to come up with more stringent regulations. So for areas in particular in the medical arena where we are active in, there's still quite a scattered landscape even in the EU, which obviously has a lot of challenges. So for a globally active company as we are, it's just very difficult to tailor everything to the needs in the respective countries. So first of all, you obviously need to monitor everything, and then you need to see which approach you take, because you can take the richest approach, which obviously then burdens all the other countries where such requirements are not available. So that's definitely one. We also then have different approaches from our customers, particularly when you look at the technical organizational measures. We see that when we have public procurement contracts and we have discussions with them, for example, for our remote service business, which is very important for us. So there is also the challenge that even if you think you do the level best, the customers still might have different approaches, and then you would have to adjust your offerings accordingly, also from a technical side, not only. I think this is one of the core pieces we are working on, and therefore code of conduct or the like would very much help to set the standard in the industry, which would make life then just easier, because then you could refer to that.
Mm-hmm. So such a code of conduct would allow us to calibrate in purpose, approach. If there are various codes of conduct that I can imagine that are being worked on, that may also not contribute to clarity, right? And that's something that I believe is important for those who are executing and implementing those rules.
Yeah, exactly. I mean, we had a discussion here in Germany from one of the associations. They tried to implement a code of conduct for the remote service. And there it was interesting to see in the working groups when we all worked together, we came from different industries. So we come from the medical area, we had colleagues who came from the telecommunication, and you always work in your frame of reference. You have different challenges. So one size fits all across all sectors might also maybe not be the best solution. But again, if you then tailor it to the various sectors, obviously more work is associated with it. But I think that is to encourage on a European level, obviously, that would be preferable for us to make it much easier.
Thank you for those insights, Katja. Hey, Shriekanth, You're the only guest here in Pforzheim, actually,
Yeah, yeah.
Which is amazing to have you here. What was your experience? What was on your mind traveling through Europe here in these times?
Yes, Carlos, thank you. We live in a pretty uncertain world right now, and everything is getting connected, but we are moving far apart. So just to attend this conference in person, I needed to change my plans, and because there were issues in terms of getting your COVID test and flying, security, privacy, safety, so it all comes together. So I actually had to change my travel tickets and drive all the way from Amsterdam, where I'm based, where I work for Irdeto, which is the global digital platform security provider. And in this sense of travel, where I came across 7 hours of driving yesterday night, I was just thinking, security is something, privacy is something, and safety. What exactly do they actually mean? So this feeling of being safe is safety, and then we have a lot of security. Security is like it can be considered as an armor, and this protection, which is provided by this armor, is actually the safety. But in this pandemic world and remote connectivity and medical devices getting connected, do we really understand the basics of cybersecurity? So this was my thought process, and I really wanted to meet people in Siemens here in person and understand what are the cybersecurity challenges we're facing, and they just stuck to my mind. And just to add on to that, there was actually a breach, a cyber attack in Germany, just not far away from here, where a patient could not be attended, go to a Dusseldorf hospital because of a ransomware attack. And this was a safety issue. For me, it was more just changing my travel plans and coming to, taking a different mode of transportation. I'm still safe, I'm still secure, but security and safety can actually lead to patient death. So this is really important, cybersecurity.
And I hate to break it to you, but the privacy is not respected because you are online with over 100 people online watching us. But we will consider the privacy concerns also. Hey, in this context, when we talk about security, and you bring up this nice picture of armor, it just brings to me that slows down. Armor locks down. In times of agility and speed, security seems to stand in its way when we talk about in the context of locking things down. When we talk about IoT, what do you see the challenges? What's your perspective on that topic? How we should handle the security challenge?
Again, armor is one analogy, but if I were to go back to the connectivity right now, right, there is this prediction that 1 in 4 medical devices are going to be connected in the future. And by 2025, we will have a lot of proliferation of data, connectivity, IoT, medical devices in a network. So cybersecurity is the new paradigm shift which is happening. So from network and endpoint, which is outside in, it is moving towards the embedded device security, the added layer of protection, which is inside out. So in this case, by 2023, 68% of medical devices will be connected in a hospital, and we have new threat vectors. So as more and more devices get connected, the network level cybersecurity is not just enough, and we need to protect. We need to have more safety, and we need to have more cybersecurity measures. So in that case, that's when the regulation kicks in, where we have traditional general safety medical device regulation, which focused on safety, effectiveness, and performance, and quality. But now it is getting towards safety, security, and effectiveness. So this pillar of security is very, very critical to have defense and design mechanism inbuilt in all your vectors, which are the medical devices, which are connected to a lot of different systems in the hospital. And companies and individuals and hospitals and systems should think about making proactive security inbuilt. And this is something changing.
Yeah. That's a great segue. I would like to bring Errol into the conversation here. Errol, we heard some great talks this morning already about also the regulations, the requirements. I think Dina did a very nice call also on the authority to hack. and there are laws coming up with a lot of fines and punitive measures also to change industry and those who are not working in compliance. How do you see this trend fit with the purpose of what we're trying to achieve here also, and we're doing very well, is sharing, collaborating, having an open space, non-punitive environment? Are these excluding each other? Can you share your perspective on the developments on that?
No, that's a great segue, and what I would offer is I think that there's an opportunity there to do some collaboration, to learn from each other, and to benefit from those learnings. And I think about when I look at information sharing, there's 4 areas that I like to consider. I mean, the obvious one is that we can learn about security issues from each other, and we can use that information to better protect our own environments. To me, that's the obvious one, and I think that it could play well into that compliance area as well. But the other things that are a little bit more subtle, maybe not so obvious, are things like crowdsourced cybersecurity expertise. And the idea that for example, with Health-ISAC, we bring this community of information security, cybersecurity, resilience, compliance, HR, all these different professionals and different disciplines together potentially to work and collaborate with each other and to learn from each other. And the whole idea is that you can leverage those experts from these other firms and compare notes with each other, and again, learn and then grow professionally. So that's one of the areas that I really like to think about. And I've been doing this for a long time. I've only been with Health-ISAC a little over a year, but 13 years prior, I was at Citibank and Bank of America, and I was a big subscriber and user of the financial services ISAC. And I was just amazed at the kind of information that I could glean from firms, from people that were at very small banks. And so people had things to offer. So it was great to see that. But the other things I wanted to bring up too really quickly here were the heightened community trust and resilience. And so again, back to your issue about compliance, I think that by getting those professionals together to be able to share, compare notes, learn from each other, understand what their particular regulators in that region, in the U.S. or Europe or Asia, for example, you can learn about what the regulators are honing in on and try to understand what's important for, from a compliance standpoint, where people should focus internally. And then the last benefit I bring up is this improved cybersecurity innovation. And again, it just reemphasizes that notion that we're all dealing with like issues, and we have an opportunity to work with each other to really drive, be thought leaders, and drive the issues that the sector is facing. So to help maybe establish standards, maybe help establish best practices through the use of surveys and again, sharing with each other and understanding what's important, what's working in each environment, and learn from each other.
I would like to pick up the topic of sharing in the sense of shared responsibility. And it's very easy to say, it's very easy to write it down, and I believe it's very hard to execute and to live. And this is probably a question to any one of you three on how do you envision us to improve, to better support this approach of shared responsibility, because it's not blame, it's not punitive, but it's about clarity, it's about proactively sharing and responding and learning. What would be your recommendation to foster a stronger culture of shared responsibility amongst regulators, vendors, providers, manufacturers? We're all part of the same supply chain that has to be built on trust. I don't know who wants to go first.
I'll go first. I was a regulator for over 5 years with the Singapore Ministry of Health. And when I would look at a security issue, I look at implementing any regulations, the overarching principle is risk, safety, and how do you mitigate, how do you minimize the risk and ensure that the patient, the device is safe. throughout the product lifecycle. So if I were to put this analogy in security aspect, you have security risk, you have safety risk, and then when you have any security risk which impacts the safety of the patient, that's the golden circle, the Venn diagram. That's the part where the regulators are focused on, whether this leads to patients no safety issue. So from a regulatory perspective, we're looking at the best for the patient. From an industry perspective, you're looking at meeting the regulations with the minimal impact, minimal cost, and minimal effort required. But at the end of the day, it's a balanced shared responsibility, as you said, and patients are at the center of everything.
Let me just have a follow-up question to that, and I'm playing my role as moderator here and try to be more provocative here. Regulators typically are specialized in their domain. Okay, so I don't deal with medical devices, or I just deal with medical devices. I only deal with privacy. So handling this equation, as you were describing, within the area will not solve it, right?
Yep.
So are there any experiences you can share on approaches that authorities took?
So this is like a multi-stakeholder initiative. Cybersecurity is obviously new for everybody. We didn't expect that medical devices would be connected to an internet or a third-party network. And so from a regulatory perspective, or people try to get experts from cybersecurity, we get experts from privacy. So if you look at EU, you have NIS directive, we have GDPR on one side, then we have the Cybersecurity Act, and in the US you have NIS. So it's a collaborative shared responsibility for everybody, and since it's a device we're talking about, it's a medical device, security regulators play a very critical role.
Thank you.
Carlos, this is Katja. Maybe I can shed another element to that. We now had a focus on the external. I think we also have to keep in mind the internal shared responsibility, and our two roles within Healthineers are a perfect example. So I think it's very important to understand from the various stakeholders what is important for the other one. So I need to understand what is critical for you from a cybersecurity perspective, where you need to understand what is important for me from a data privacy perspective. Because usually the incidents, ideally, they come in through two chains or through two channels, but not necessarily. So we need to understand the various stakeholders in a company who need to know about such incidents. The second, we need to build on a corporate memory. So it might be that, for example, one product line is impacted, but then we need to make sure that we cross-check into other areas in the organization where that could also have an impact. So these shared responsibilities, not only in the external, but I think a large chunk of our work is also to get our arms around these internal challenges, make very clear who internally needs to learn what. What do I have to take care of? What's your responsibility? And if you have a larger incident, you better have figured that out prior to having that, because if it's coming, you have your hands full with something else. So
I can share with the public that I am so happy to have such a strong partner, brothers and sisters in arms, where privacy and security play together, not because of process or regulation, it's because we know each other, we cheer each other up in our areas, and we support each other with information, because at the end of the day, we have a common purpose. Thanks for that insight, Katja. Errol.
Yeah, one thing that I would add there, now focusing externally, is an example I can bring up is this committee with Health-ISAC, I just have here, called the Medical Device Security Information Sharing Council, or MDSISC, a lot of letters there. But John Crossan, one of our moderators here today, is actually our Health-ISAC representative to that group. And when I got to Health-ISAC, I thought it was a really interesting committee that we have been able to get going and keep going and deal with some really interesting topics. And it's made up of dozens of medical device manufacturing organizations and also dozens of healthcare delivery organizations. And bringing those two very disparate groups to the table to deal with some common issues that we're dealing with when it comes to the delivery, ultimately to the delivery of healthcare and patient safety and security. And one example I can bring up, thinking about the shared responsibility, is on the coordinated vulnerability disclosure process. And so we've done quite a bit of work there to help out organizations with that process, make sure that people go through that established process using best practices across the industry. And so the medical device manufacturers have done a terrific job of sharing best practices and learning from each other. And then on top of that, we also were able to develop a media kit. So as many of you probably know, you do the right thing, you release a vulnerability disclosure, you have a patch for it, and the next thing you know, you see an article in the paper that says, my gosh, there was a vulnerability and it could have killed somebody if it wasn't patched. So you're doing the right thing and then you're getting blasted in the media. So we developed this, this media kit to hopefully educate the reporters and the people that are covering those kinds of stories, and to hopefully get them to produce responsible articles about these kinds of issues.
One thing I'd like to add to this is, since H-ISAC is more US driven, it's wonderful that we have this in Europe and we have that in APAC as well. And one important thing is big companies, big organizations, big manufacturers have resources, and smaller companies are usually left out. So getting everybody involved, and that's what Irdeto's mission is, to build a secure future so that people embrace connectivity without fear. And we can also get everybody in the ecosystem to come in and build secure devices, so that information sharing happens and then cybersecurity risks are mitigated.
Yeah, and I think this is something that kind of triggers the question that I would like also to ask, and start with Errol now, just to change the sequence here. Errol, when I hear the discussions on cybersecurity and privacy and all those rules and regulations we have out there, I see a strong theme of fear, a theme of doing something wrong. So as you were just saying, I want to do something right and share quickly, and then boom, you get the blast in the public. And I think there's a lot of fear. How do you envision us to overcome awareness more into knowledge, as we're all citizens in this digitalization era? Because I believe that's an important influencing factor to change our approach.
Yeah, and it's. I think we have a long way to go, Carlos. I think it's just unfortunate because we've just got this culture of blaming the victim, right? So when there's data breaches and these ransom incidents, and Sri brought up one of them earlier, we tend to blame the victim organization, that they could have done more, they should have done a better job of maybe protecting that environment. And not really focusing on the evil behind the criminal actors. Yeah. And I think we really need to change that mindset.
Like events like this here. Katja, any thoughts from your side?
Yeah, I fully agree. I mean, this scapegoat approach is sometimes not really contributing to have open discussions. And usually best practice sharing is good, but usually then you would have to disclose that something went wrong in your organization. So if it had been in the press, I mean, you don't escape it, and then you can more or less openly talk about it. We in Siemens, with the compliance issues we had in 2007, then it's easy to talk about. But otherwise, you try to keep it also on a, let's say, try to keep the ball flat, and then it makes it a little bit difficult to speak openly about lessons learned and stuff like that. So therefore, associations where there could be, let's say, in a protected forum, discussions also to make sure that there is nothing, let's say, illegal going on between competitors. I think that's still very, very beneficial for everyone, as everyone tries to do the best. I mean, there's good intention behind it. Sometimes it's just a very high hurdle to be able to do that and get respective guidance.
Yeah.
I can build just really quickly on what Katja said. It just reminded me of the culture again that I was dealing with at the large bank sector, was where we were talking about introducing like a bug bounty program, and it was like, my gosh, we can't talk about a bug bounty program. That would mean that we're admitting we have bugs.
Yeah.
I'm
sorry. It was truly a bug right here who fell over right now. So yes, we have
good timing. We have more bugs. But the good news from that perspective, though, is that the mindset is changing. So we do see a shift in the culture. It's slow, but I'm hopeful that it will continue to change.
I think talking about the shift in culture, we're having a digital transformation happening in healthcare right now. Everything is going towards virtualization, and telehealth is happening. So privacy becomes a very, very important aspect there. So like I received a COVID test today, it came in an email. So that is something I would consider breach of privacy, like data privacy is big issue. And then as we get into the remote patient monitoring with critical, like if you have a dialysis machine going into home of a patient, you need to have more security. So security and privacy are two sides of the same coin, I would say.
I know that we could go on for a bit longer in having this wonderful conversation and dig deeper in various areas. And those who are the audience, who are online, feel free to share your questions with us. I have them here. In the meantime, I would like to ask each one of you to think about a personal recommendation to the audience in the times of growing regulatory uncertainty or hopefully growing clarity for implementation, for shared responsibility on privacy or security. What is your personal recommendation to the audience just to stay focused on?
All right, I'll start with it. So I'll say to everybody that if you have a device or a software which connects to an external network or internet, try to think about cybersecurity, the basics of cybersecurity, security protection, and privacy from the beginning, from the initial design stage throughout the product lifecycle, end to end, and think about it because you need that from the beginning.
And to add to that, that is, I think, a great thought on those who are buying the devices.
Correct.
To design their processes accordingly, right?
Yes, and ensure you get support. If you don't have support, get it from external sources, reliable sources, and make sure you're part of community like H-ISAC, which is information sharing and building this security layer from within.
Thank you. Katja, do you want to go, or Errol?
Maybe from my angle, what I considered key in the years I've now been the data protection officer is training across the organization. Usually, and I speak for Healthineers, and I guess for many other companies, it's not the problem to get the tone from the top, and also management one level below. They understand the challenges, but you need to train those who need to implement the topics. They need to understand the details. They should also understand why they have to do that. And that I deem fundamental. Then you get the buy-in, and only if you get it in the DNA of the organization, so really at the bottom level, it will work and we will be protected. If it stays too high up, you won't gain anything. Because the managers, with all due respect, they don't do the groundwork. They are ultimately responsible, but the ones implementing the topics, they need to understand that. So training for us in Healthineers is absolute key, and I deem that as a snowball system to get it into the organization.
Thank you, Katja. Errol.
And I'll focus on information sharing. So I just would encourage you, lead by example, share, get into these information sharing forums. Don't be afraid of the larger organizations. As I mentioned earlier, even when I was working in places like Citibank, who had tons of people in the information security organization, I was still learning an incredible amount from other smaller banks. So don't be afraid of or be intimidated by others in the information sharing channels. Get out there and share. I guarantee your peers will appreciate what you have to offer. And I think that you'll also be able to learn and grow through the experience.
Well, thank you very much for those insights. I've not seen any question come in so far, but I would like to take the remaining time just also to thank you to take the time to come here. Definitely, I will enjoy the time having you here, and you guys also logging in. What I take away also from this conversation are things that are known, but it's very important for us to share, to speak to them. It's about clarity of requirements, ownership, knowledge in the organization, and also a culture of trust that we can share because we want to learn and improve. So to me, really, this comes down to security and privacy are truly in healthcare a quality requirement where we all contribute, and it's not a fixed state. It's an evolving state. And that's, I think, where we as community can really make a fundamental difference to healthcare and to the patient's safety. We're over time. Thank you very much. John, if you're there, yes, you're there. Wonderful. This is working now well. So after a bumpy start, we're just warming up. This is wonderful. John, back to you.
Thank you very much, Carlos. Great wrap up. Very great discussion there. Thank you for moderating that. And a big thanks to Errol, Shriekanth, and Katja for joining that panel discussion and for sharing all that great information. It could have went on, like you said, Carlos.